starting, and here is your question.
Okay.
Okay. If you have read and understood, considering it communication skills station, kindly please begin.
Yes. Okay. So I'll come to the room and I will greet the patient. Hello, Mr. X. I'm Dr. Jeff. I'm one of the exam candidates today. So I think you have some concerns about your warfarin. Is that correct?
Yes, doctor.
Okay. I would like to know what's your issue. What questions do you have? And let me know if I can help you. And I'll explain it to
So
you.
my doctor
Okay?
told me that I should not stop this medicine because it will threaten my life.
Okay. Yeah, that's right. But let's explain what this medication is, what this drug is actually. So warfarin is a blood thinner. So it helps in your situation, which you have a mechanical valve. It helps the valve to stay for a longer period of time and to let it not have blood clots on the valve. So this is in this situation, in your situation, it's really critical and important to take this medication regularly and for until you get advice from a doctor to stop it. So in your situation, before a surgery, we need to stop this medication and to replace it with another medication that works just like that. And it helps your valve function well, and it's better for the surgery. Is that clear so far?
Okay. So why
Yeah.
heparin?
Yeah, we have an alternative which is called heparin. It works almost like warfarin. It's a replacement, but it's an injection. So you will take this medication like 5 days before the operation, before the surgery. We stop the warfarin, which is a blood thinner, just like heparin, and we will give you this injection until your operation finishes. This is better in your situation. It helps us to have less bleeding and to have a better result in the surgery. Is that okay?
Okay. So when I can resume warfarin?
Yeah, you can resume warfarin after we make sure that you don't have any bleeding after the surgery. And when we make sure, which is usually the day after the surgery, or maybe when we make sure that you don't have any bleedings. Okay? Because warfarin is much more potent than heparin, and it takes much longer time to reverse it. The effect is much more longer. It takes longer time to reverse it. So we have to make sure that there's no risk of bleeding after the surgery, and then we will start on warfarin again.
Is it necessary to stay at the hospital prior to the operation?
in your case, we prefer for you to stay because in this situation, in your situation, I think it's preferable to stay in the hospital to make sure that you get the injections at the specific time and the specific doses. Because as far as we know and about your history that which is written in your notes that you cannot do it yourself. So we better to keep you under medical attention, and we give you the medication and the injection before the operation.
Okay.
Okay.
So I'm also taking
That-
anxiety medication. Is it necessary to stop my anxiety medication, anti-anxiety medication?
Oh, thank you for telling me that. So you are taking diazepam, right?
Yes.
Okay. So in terms of bleeding, it's not related to bleeding, or there's no risk of bleeding from diazepam. And from my point of view, from the surgical point of view, there's no, it's not necessary to stop it. But for that, I will try to contact the anesthesiologist consultant, and I'll refer you to him to discuss that issue with you. If he has no issue, you can resume and you can take it before the operation. By the way, if I can
Okay.
tell, or if I can ask you, do you take any other medication? I mean, besides
No.
diazepam?
No.
Okay, that's good. Do you have any other question or any other concerns?
No, doctor.
Okay, is it clear all for you?
Yes, it's clear.
Okay, so I will summarize what we discussed today. Okay, so as we can
Yes.
be on the same page. So you came today to have a clarification about your warfarin dosage before the surgery. As I told you, warfarin is better to be stopped 5 days at least before the operation to decrease the risk of bleeding. And we will give you, while we stop the warfarin, we will give you a replacement, which is heparin in your case. This works just like the warfarin, and it helps you in your situation. And we will resume you on your warfarin whenever after the operation, when we make sure that you have no risk of bleeding after the operation. Okay?
Okay.
Okay. So we will, and about the diazepam, as you told me that we don't have any concerns with diazepam, and that's what we discussed today. And thank you very much. Thank you.
Okay. Thank you, doctor.
Thank you very much.
No, maybe you can hear the bell. No, it went. Okay. Right.
Okay.
Thank you.